Okay, we're going to now look at some chimeric antigen receptor or CAR T cell therapy case studies. So our first case study is a 69-year-old female. She was admitted with large B-cell lymphoma. She'd had this since 2006. Her history is she had a remission which was achieved in 2006 just with chemo and radiation. She relapsed in 2016 and then received chemo and then a transplant in December 2016. Her lymphoma returned in November 2017 and she returned to care in February 2020. She's a candidate for CAR T therapy because of 2 failed treatments. She was admitted on the Monday, which is standard, and received her CAR T cells around 1:30 that same day. We usually try and shoot for 1 o'clock. So let's look at her baseline vital signs and eye screening. Important to know what our baseline is. So she came in with a temp of 36.7. Her heart rate was 74 with a blood pressure of 119/60 with oxygen saturation of 95% on room air. So let's look at her eye screening. She scores 10 out of 10. So it's important to know what the scoring is. So with orientation, you get 4 points. 1 point for each right answer, which would be the year, the month, the city, and the hospital. Naming objects is worth 3 points, where the nurse points to 3 different objects and the patient needs to identify them one at a time. Following commands, this could be as easy as poking your tongue out or maybe taking your right hand and sticking it on your left ear. Easy following commands. Writing a sentence, this is where the nurse actually dictates the sentence. So they will tell the patient the sentence, they write the sentence along with the date and the time. And the final point is for counting backwards from 100 by tens. This makes up our 10-point score. So the patient actually, day 0 was their infusion date. We mentioned earlier they actually received their infusion at about 1:30 that day. They had no issues at all. Everything went quite smoothly with their infusion. However, right before midnight, patient was showing their first signs of cytokine release syndrome. With at 23:43, they had a temperature of 38.3. Their eye score was still 10 out of 10, no neurotoxicity at this time. So day 1 after their infusion, the patient's having persistent fevers, now with hypotension, again consistent with our CRS picture. Eye screening still 10 out of 10, no neurotoxicity at this time. So let's look at a closer look at her vital signs. You can see she's having many fevers, respiratory rate going up at some times. She's receiving acetaminophen around the clock. She's had 3 boluses of 500 for her low blood pressures. And then because of this picture of the low blood pressures not necessarily responding well to boluses and the febrile situation, that's deemed she's probably grade 2 of CRS. So at 18:40, she receives her first dose of tocilizumab. So let's see what day 2 after infusion brings us. So you see her eye screen is she's still showing a 10 of 10 score, no neurotoxicity indicated at this time. But let's have a look at what her vital signs are doing. As you can see there, she's still continuing to have that hypotension. giving her boluses. In actual fact, you see there at about 6 o'clock in the morning, they gave an albumin to try and improve that blood pressure. She didn't do anything. Her temperatures, she had a temperature of 38.2, but she seemed to be afebrile, but still with the low blood pressures, they decided to give the second dose of tocilizumab at 8:25. Still, however, at 19:20, you see she did spike again to 39.5, with the respiratory rate going up again. So with that second dose of tocilizumab, we know we can give that Q8. So it makes sense. This was when her second dose was given. Moving on to day +3. Her ice score, as you see, we're still getting a 10 out of 10, so she's got no neurotoxicity at all. And we're looking at it, you can still see she's still febrile, still getting that Tylenol around the clock. At 3:55 with her 39.5, her respiratory rate went up also to 24. We're actually just doing Tylenol ice packs on her. It does seem to bring her temperature down every now and again, but for the most part she seems to be above 38 most of the day. So day +4, her ice score is 10 out of 10. Day +4, day +5 is when we sometimes start seeing those neurotoxicities. Let's look at what her vital signs are doing, if they're improving at all with 2 doses of tocilizumab now on board. So we see she's still febrile, but however now she's needing oxygen. We started her on 2 liters of oxygen around 2 o'clock that day. She remains on that oxygen and will be indicated as we go on when it goes off or if it stays on. She also in 23:35 had an episode of Rigers and was given Demerol to try and correct that. She only received 1 bolus of 500 milliliters and basically still receiving that Tylenol around the clock. So day +5. Well, now she's starting to have some neurotoxicities noted. She's stuttering and having difficulty with word finding. This is often what we see, that word finding issue is often the first sign we see of neurotoxicity. So here you can see her ice score screening as well as her vital signs. So she's still febrile, still having Rigers. Demerol was working for the Rigers that she did have, but she has a couple of episodes of hypertension you see there. Her respiratory rate is in the 20s consistently now, 20s and higher. Around 1 o'clock, you see her writing has become an issue and she no longer could count backwards from 100. So she scores at 8 out of 10. For her neurotoxicity scoring. The 3rd dose of tocilizumab was given around 3 o'clock, along with 10 milligrams of dexamethasone because of the neurotoxicity was actually becoming an issue. So they gave her some dexamethasone. She's a little hypotensive around 11 o'clock with a low heart rate. She's bolused again, and she's still having issues with her handwriting. She's only scoring 9 out of 10 for her eye screening. They actually ordered a CT, an MRI, and an EEG on the patient. So the CT was negative. The MRI was found subtle new signal abnormalities in the pons, most focal in the dorsal left pons. Her EEG was completed with moderate generalized slowing, consistent with diffuse cerebellar dysfunction. So it's clear the patient is having neurotoxicity, and because we've given the dexamethasone, it's usually graded at a grade 2 at that time. Today plus 6, she's having increased language disturbances manifesting as expressive aphasia, delayed responses, repeating often with attempting to answer. She has declined ability to write sentences, and she had a little tremor early on. She still remains tremulous at this point. So let's look at her vital signs. You see at 1 o'clock she was a little hypotensive and they gave her a bolus. She's tachy at times now. Tachypnic, at times now. They tried to wean her off oxygen or wean her down to 1 liters, but she didn't tolerate it and she went back to 2 liters straight away. Her dexamethasone is now ordered Q6 around the clock. By noon, the patient's eye screening is actually a 5 out of 10 now, and she is not improving. And the decision was made to transfer her to the ICU at shift change. So let's take a look at her handwriting, because often this is the handwriting is a good indicator for us what's going down. So you see here, she's starting to make some mistakes. How she's writing down the sentences she's been asked to write down. The first one here, you are a cool drink of water. The word water was no longer legible, and it doesn't even look like the word water. The next one, it says sunny days are coming. For some reason, she's put sunny days are going. When we see the numbers, it's often an indication that something's going down. So numbers are really not correlating to what they're supposed to be. Hard to decipher, and those actually don't indicate a time at all. Very difficult to see that is actually a time. So it's one of our neurotoxicities to see. So handwriting is clear neurotoxicity, and also the date, writing the date, the interpretation of sentences, and illegible handwriting. So the things we see in the handwriting part of the neurotoxicity screening. So day plus 7, she has a lumbar puncture done. This is not only to relieve pressure, but also to help with diagnostics. In their CSF, they found 74 white blood cells, 3 red blood cells. The white blood cell count contains 0 neutrophils, 99% lymphocytes, protein 64 on glucose 77. They also found in her CSF she's HHV6 PCR positive. This was actually negative in her plasma screening. She was negative for CMV, EBV, adenovirus, and HHV6, although the CSF showed that as a positive. Because of the positive status of the HHV6, she was started on ganciclovir Q12 for the next 2 weeks. Also, because of the dexamethasone, she was now having issues with the blood sugars. She started on sliding scale insulin, and then was transferred actually back to Fort East at this time. So let's look at her vital signs during this time. You see her eye scoring down the side there. It's going to correlate to the vital signs also. So she's actually developing bradycardia now with a touch of hypertension at times. And although her eye score is actually improving. The patient was actually discharged on day plus 12. She was not quite back to baseline. She still had some tremors and some handwriting issues. But when she was discharged on day plus 12, her eye score was actually a 10 out of 10. So So let's look at our second patient, which was one of the more unusual case studies because we hadn't seen this before. So patient number 2, she's a 51-year-old female with relapsed refractory B-cell lymphoma. Again, her cells were infused on day 0. Her neuroscreening throughout the whole time was 10 out of 10. She never had any day plus 4 or day plus 5 neurotoxicity, and her handwriting actually never faltered, which was very unusual. So basically she sailed through this up until day plus 9. So day plus 9, the patient was due to be discharged. She had no neurotoxicity, very little CRS. She was all ready to go home. Noon, her husband stated that he thought his wife was actually acting a little weird when palliative consult was being done in the room. At this time, her eye screening was still 10 out of 10. No actual issues that you can note, other than the husband had a little bit of a feeling that things weren't quite right. So by 4 o'clock, her eye screen was completed. We do it every 4 hours. She was actually verbalizing she was very tired and wanted to go to sleep. So they let her take a nap. At 5:20, the RN went in and woke the patient and noticed that she was having some word finding issues. The patient did, however, correct herself during that conversation, and the patient was easily woken with no other neurological symptoms or issues noted. The RN, however, notified the team of the word-finding issue, but no one actually was alarmed at the time. However, it was noted, and then the next course of events was at 6 o'clock. The APP actually came to visit the patient. When the APP actually came to visit the patient, she noticed something wasn't quite right. And at 6:10, the RN and the APP actually completed an eye screening tool, and she scored like a 2 out of 10. She was able to follow one command, and she was actually able to name one object, which was a pen. So the APP called Neuro to the bedside. The team lead and rapid response were notified, and both came to the bedside. The vital signs were basically stable at this time. At 6:15, HIMS was actually on the floor and went and looked at the patient. By this time, the patient had declined further in just that 5 minutes. She's now scoring 1 out of 10. They're concerned that she has grade 3 neurotoxicity. They gave her IV 10 milligrams of dexamethasone and started every Q6 hours regimen. They consulted neurology and the critical care medicine, and at the request of neurology, she was also received a dose of tocilizumab. She had an immediate CT of her head without contrast, and then after the CT, the patient was then transferred down to the ICU. So about 7:26, there's an extra 5 in there. She had actually significantly improved just from that one dose of dexamethasone and the TOSI, and now she's scoring a 9 out of 10. And her neuro exam is actually within normal limits. She's not out of the woods yet, though, and at 10 o'clock, her ice score declined to 6 out of 10, and then further declines at 11 o'clock to 4 out of 10. She's still continuing that Dex 10 milligrams every 6 hours. So she still remains down in the ICU at this point in time, not ready to transfer back. So they didn't do a spinal tap. They thought they were going to relieve some pressure, but because her counts came back up, her scores were coming back, they didn't. They did an EEG and a CT. The CT findings was no bleed, or infarct or hydrocephalus, no intra or extra axillary fluid collections, and ventricular system was normal. The grey-white matter attenuation was within normal limits. Orbits were normal. Paranasal sinus, mastoid, and air cells are clear. No acute intracranial abnormality. The patient's vital neurostatus started to rapidly improve. Neuro was ordered Q1. Eye screenings, but and the score. You can see the scores there every hour. So she dropped that at 10 o'clock and 11 o'clock, but from then on she improved rapidly, and by 5 o'clock onwards she was scoring 10 out of 10 again. So let's look at her handwriting. Again, we often use this as a good indicator of what's going on with the neurotoxicity with the patients. So the day before her ice screen tool plummeted is when she's this is when she starts to decline where the arrow is. But the day before her eye screening plummeted, she's having trouble writing the time. She writes 1:40 when the actual time should be 8 o'clock. And again, here we see difficulty writing the date and the time. And again, you can see that the handwriting is getting worse. Again, those numbers, they have quite a bit of difficulty writing down that calendar date and the time. So things we have learned. So we know most patients often start neurotoxicity day +4, day +5. However, that one patient we just went over was out of the box. She didn't do anything until day +9, which is very unusual. But there are some key things that we always look for before that ice score screening drops. They often have that difficulty writing numbers. They often sometimes start with a fine tremor. Sometimes more difficult to wake, more fatigued, and there's word finding issues. So because of the pointing things out in the room, we're actually going to trial using flashcards for object identification, because we're afraid that muscle memory is involved with pointing out things in the room. Thank you.